in mind as we move forward. Thank you, everybody.
All right, you know what it is? He said 10 minutes exactly 21 minutes ago. Maybe he saved or created 11 extra minutes. Hello, everyone, and welcome to Happy Hour America Bowling, along with Cody Willard, and Sandra Smith is sitting in for Rebecca Diamond
Does that
tonight.
create time inflation?
Not at all. The president finishing up with leaders from both sides of the aisle in his long-awaited televised health care summit. I may be just a political junkie, a policy geek, a hack, or all of the above, but I really did enjoy that healthcare summit today. I did, Smitty.
Wow.
I really did. There were wow moments, aha moments, and times I wanted to yell at the screen, and that was just while Pelosi was speaking. But in the end, it was more than talk. Was it more than talk, or were there actual negotiations going on? So will any real compromise come from the healthcare summit? Joining us now from Washington, D.C. is California Congressman Brian Bilbray. Congressman, thanks for joining us. You know, we saw a lot, both sides of the aisle being very partisan. Is there any real chance for compromise out of this?
Well, I was sort of shocked at the end when the president said there isn't time to have another 6 or 7 hour meeting on something that he claims is so essential that will probably be a 60-year legacy. I think Rangel was a surprise when he said, look, maybe we ought to be sitting down and working through our system and redoing this. Obviously, guys, back a year ago, the statement was, elections matter. We don't need to sit down and work with the Republicans. The year has passed, and obviously the tune has changed. But I just can't believe we can continue to talk about reducing costs or hoping to reduce the cost of health care without being willing to drag the lawyers into the works. The Republicans last night voted to make the insurance companies address the issue that we took away their exemption from monopolies. But will the leadership, will Pelosi now bring up tort reform and talk about that thing? Because I just can't believe they continue to sidestep the issue that you got to get the lawyers out of the operating room if you want to make it cost effective.
Congressman, this is Sandra Smith. Thank you so much for joining us. You know, the president spent many of the past 20 minutes or so defending what he called all the talk of a government takeover. From what you heard today, are you convinced that this plan is still not a government takeover of the healthcare system?
Oh, I think they know right off that they want there to be a system that reflects a social model. That's always been their plan. They've talked about it for years. The president announced that long before he was a president, that's where he would like us to go. The fact is, even though he's an attorney, I can't believe how they can walk away from the billions of dollars of savings again and again and again. You think they would say, well, Europe has this health care program and Canada has this health care program, and ignore the fact that, yeah, and they also don't have our tort exposures and they don't have as many trial lawyers as we have. So, no, the president, I think, is really exposed on this one by saying he wouldn't be willing to sit down for another 6 hours. That's what it took.
Congressman, you know, it's great to see things televised, but as you're hitting on there, he's saying we can't do another one. One of the few places that we actually heard any real coming together was, and bipartisanship was, going after fraud, including, I don't know, creating fake patients we're going to send in. I mean, is there any chance we're getting anything substantial out of this and not some jokes like we're going to have someone pretend they're sick and go to the hospital and do more Illuminati work or something?
Well, I think you got to remember that people in Washington think that the problem is not the substance of their proposal. It's just that the process didn't please the American public. You've heard them say that. I've got to say, Chairman Rangel said it quite clearly that the substance does scare the American people, and I think that there's one guy who really stood out was Rangel being frank about the problems with the bill. I think Tal Coburn really sort of opened it up. He's a man who's practiced law and seen the way Washington makes sausage, and I think that he kind of really hit the process that, okay, if you want to talk about fraud, be brave enough to use these undercover patients and be able to bust it out. But he still came back to the fact that cost has to be addressed, and you can't have any sacred cows. And Washington's still trying to protect its sacred cows.
Congressman Bilbray, we only have about 30 seconds. Would you just comment, for me, the defining moment of this whole 6.5, 7 hours was when Representative Paul Ryan from Wisconsin stood up and said, hey, your numbers don't jive. We can't come to a deficit neutral or a deficit reducing bill here. That was a great moment. How about you? Do you back him? Do you support that?
Paul Ryan is a rising star in Washington, no matter what your party affiliation is. He has the respect He has the integrity. And, you know, he's not only a good messenger, he's got the facts. He makes sure that before he stands and says something, that when they look at and they try to audit him, he comes out. This is a kid that you keep an eye on that young man. He's somebody that Washington really is impressed with.
Agree with you 100% there, Congressman Bilbray. Thank you for joining us from Washington, D.C.
That makes one of us.
Thank you very much.
All right, you have to have health insurance. That's the president's proposal.